Good morning, Jared. Good morning, Dr. Sharma. Can you hear me?
Taranjit Kaur ji, Vaheguru ji ka Khalsa, Vaheguru ji ki Fateh.
Okay, good morning, everyone from Toronto, and good evening and good afternoon, other part of the world. This is Sunday, September 12th. Welcome to Ontario Homeopathic Medical Association free live webinar with Dr. Muktinder on a very, very important subject. I am requesting Professor Bhupinder Sharma to start this session, please.
Thank you, Dr. Javed. Good morning, everyone from Toronto and all parts of the world who are attending this event. I am Muktinder Sharma, professional member of the Ontario Homeopathic Medical Association and moderator of this webinar conducted by the OHMA. I welcome our guest speaker, Dr. Muktinder Singh, MD Home, a renowned teacher and homeopath from India, who will be speaking on a very important topic, a homeopathic perspective of obsessive-compulsive disorders. According to a latest major study conducted by McMaster University, it finds that 1 in 5 Ontario children suffer from mental health problems. And we have many OCD cases which are not very often reported to us by many families. So I know that taking account of the time, I will be requesting OHMA President Saroj Gandhi ji to welcome and introduce Dr. Muktinder. Madam Saroj.
Thank you, Dr. Sharma. It's my pleasure to introduce and welcome Dr. Muktinder Singh ji, MD Homeopath, a renowned teacher and speaker from India who specializes in classical homeopathy, especially dealing with pediatric cases, behavioral problems, autoimmune disorders, and advanced pathologies. He is director of HomeoCare, a chain of pediatric specialty running clinics all across India, and chairman of the Indian Institute of Homeopathic Physicians, a very prestigious and renowned organization in homeopathy. It will actually take many more hours to read his achievements and credentials. But as this webinar is only for 2 hours, I would now welcome Dr. Muktinder Singh ji and hand over back to Dr. Sharma to moderate this event. Thank you.
Thank you, Madam Saroj. I request the participants to send your questions and also greetings through chat box only. And I will take them at the end of the presentation. Please put your phone on mute for avoiding noise during the presentation. Now, this presentation is being recorded. You may please start your presentation, Dr. Muktinder Singh ji. Thank you.
Thank you, Dr. Bhupinder Sharma ji, Dr. Saroj, and Dr. Javed. These are the only names I know of Ontario Homeopathic Medical Association. Actually, Dr. Taranjit Kaur, she's my colleague and a student also. She has introduced me to this prestigious group. So thanks to all these people, the beautiful people, and I am very delighted to be here this evening because the Canada, the Ontario state has a lot of Indian community. And homeopathy, although has originated from Germany, but has flourished in Asian subcontinent. Yeah. Pardon, is there any disturbance by or is a question? Dr. Bhupinder ji?
Yeah, so we have requested everybody to mute their audio. So did you mute, Mr. Javed? Can you please help me?
So I am muting whoever is open, but please continue. Yeah.
No, it's fine now. Dr. Muktinder, you can continue.
Thank you.
Kindness, compassion, unconditional love. हमारे बच्चे होना चाहिए universal love.
So, Indian continent, we were just talking with Dr. Sharma and Dr. Rose that Indian continent has embraced homeopathy in its true sense. And now it's the hub of homeopathy. Indian continent, Indian subcontinent is hub of homeopathy all over the world. So I feel very honored on presenting this. I have chosen this topic because this was one of the toughest cases I have faced in my practice, where in my early days of practice, to get a result, there was no clue. I was totally clueless. But with grace of God and the understanding of the organ of medicine, I have succeeded recently in some cases, very successfully treated some of the cases. So I'm presenting this topic to all of you, and I hope that you will absorb it. And at the end of the day, we'll have very healthy discussion and some active participation from all of you. Dr. Govinder, this is something which will disturb me.
Yeah. So, Mr. Javed,
you can do one thing. You can put all on mute.
You're all on mute, yeah.
Yeah, and there is an option that a participant cannot unmute themselves. So that would be better if you put that function on. In the security, you will get a function that participants cannot unmute themselves, because sometimes unknowingly background sounds they disturb.
Okay, I am going to mute everyone. So Dr. Muktinder, please unmute yourself, because for the privacy, we cannot unmute anyone. So unmute has to be done by the participant. Okay, so I have unmuted everyone. Dr. Muktinder, please unmute yourself and speak.
Yes, I am unmuted. You please put a meeting of, there is a setting in the meeting where no one can unmute themselves without the permission of the admin.
Yeah, I think that has to be done before starting the meeting.
You can do it now even. Anyway, I'll start, and I hope there would be minimum disturbances. So my topic of the day is OCD, means Obsessive-Compulsive Disorder, a homeopathic perspective. So there's a quote slide that people who live with OCD drag a metal sea anchor around. Obsession is a brake, a source of drag, not a badge of creativity, a mark of genius or inconvenient side effect of some greater function. So people who live with OCD, they live very hard life. So structure of my presentation would be in this way, that first the introduction, then the definition, case, causes of OCD, signs and symptoms, how to diagnose, treatment and prognosis, the probable medications, some more cases to understand what we have read, homeopathic viewpoints, strategies to decode cases, follow-up observations, and at the end of summary. Actually, when I was making this presentation, I started with a target to have a 2 hours presentation, but the matter was flowing like anything. So I have made more slides. Whatever I could cover, I would present it today. And if there is some remaining part, we can have it in some next sessions. So obsessive-compulsive disorder features a pattern of unwanted thoughts. So when a person, because we all get thoughts are part of our subconscious mind. We all keep thinking all day. So it is a pattern of unwanted thoughts and fears these are called obsessions, that lead a person to do repetitive behaviors. That is called compulsion. So these are the two basic words, obsessions and compulsions. And that makes this disorder. So these obsessions and compulsions interfere with the daily activities and cause significant distress. So OCD is not about habits like biting your nails or thinking negative thoughts. An obsessive thought might be that certain number of colors are good or bad. So this can be the thought. A compulsive habit, on the other hand, might be to wash your hands 7 times after touching something that could be dirty, or although you may not want to think or do things which you feel powerless to stop doing. So this is what, so where you see an OCD patient. So people around you who are very fussy and fastidious, who keep washing their hands, who are not smiling because they are in great distress inside, as if something is going on in them, to whom it is really hard to convince and seem perfectionist. So there are people around you who are very hard to convince and who seem perfectionist, who keep on repeating same things time and again, and who check things again and again. So if you find someone around you who is showing any of these behaviors, you can suspect a case of OCD around. Otherwise, we all double check or triple check something. Supposing we are counting notes or we have logged it. So sometimes we have a doubt whether I will logged it. We forget it. We have locked the door or wonder if we have left the water running. And we want to be certain. So some of us are perfectionists. So we go over our routine several times to make sure it's right. But that is not an abnormal behavior. Now, don't stop. Don't start connecting or don't start thinking over it that if you are doing such behavior means you are an OCD patient. Every trait, we all have every trait in it. So when we talk about its pathophysiology, we'll discuss that why this happens. So what exactly the OCD is, but if you have obsessive compulsive disorder, you feel compelled to act out certain rituals repeatedly, even if you don't want to. So the clinch is, the main point is that supposing you are checking something and you can stop yourself, but if you don't have a break, if you don't have a stop button, that means there is something which need to be addressed. So OCD in which people have unwanted, so they create a kind of mess of their thoughts. So the people who suffer OCD, they are having unwanted, repeated, distressing and intrusive thoughts. These are the words. Unwanted thoughts keep intruding your mind. They are so repeated that you cannot control them. They distress the person. Feeling, ideas, even if these are about the sexual thoughts, the person who suffers from OCD and has sexual thought, he will not enjoy those sexual thoughts. He will be tormented and distressed by those thoughts. So that is obsession and related compulsions which attempt to neutralize the obsession. So they get an obsession, then they are compulsively doing certain things and to neutralize those compulsions. If they are not doing it, they feel anxious. So in order for a diagnosis of OCD to be made, this cycle of obsession and compulsions becomes so extreme that it consumes a lot of time and gets in way of important activities that the person values. The first case I got in my lifetime of OCD was a person who was a politician and he was to quit his politician career because he always get an obsessive thought that my tummy, my abdomen has not cleared, my bowels has not cleared, I'm constipated. Although he passes 4-5 stools in the morning. So I gave him Naxwamika and all those. It was early days of my practice, but I could not help him. But later, after many years, when I understood that this was his OCD, which was causing this thought that he has not cleared his bowels, was an obsessive thought. And he used to go to the loo for 100 times or 50 times, and that ruined his career. So one may try to ignore or stop obsessions. The main point is, even if someone is trying to ignore or stop obsessions, but that only increases the distress anxiety. Supposing someone is getting some impulse to touch something, If he is not doing that thing, that will create anxiety. So and ultimately one feels driven to perform compulsive acts to try to ease that stress which he is getting. Despite effort to ignore or get rid of bothersome thoughts or urges, they keep coming back. This leads to more ritualistic behavior, the vicious cycle of OCD. So this makes a vicious cycle that you are suffering a thought, you are trying to ignore it, you are not able to ignore it, and then you are again trying to solve it, and still you are avoiding. If you are avoiding that thought, you get more anxiety, and if you are not doing that thing, if you are doing that thing, it is such a vicious cycle that no, you cannot prevent that cycle. So basically there are four major type of OCDs: checking, such as checking the locks, alarm system, ovens, light switches, thinking you have a medical condition like pregnancy or schizophrenia, which is imaginary; or contamination, fear of things, that you all know that most common symptom of OCD is washing hand. So they get a thought, compulsive thought of contamination, mental contamination involved feeling that you have been treated like a dirt. Some symmetry and ordering, so keeping the things, as you see that autistic kids, they start queuing up the things, they keep the things in an order. And ruminations and intrusive thoughts, and obsession with line of thought. Some of these thoughts might be violent or disturbing. So what an OCD patient thinks: obsessions and compulsions are the things which goes in the mind. Many people who have OCD know that their thoughts and habits don't make sense. So the patient is already aware that I'll show that in one of the case also. The patient himself says that these thoughts are coming to me. I know they are useless. I know they are not relevant, but still I can't help myself. They don't do them because they enjoy them, but because they can't quit. And if they stop, they feel so bad, they start again. So obsessions, what are the common obsessions? Some thoughts can be recurring and intrusive. Obsession, definition of obsession is that these are the thoughts which are recurring and intrusive. They overpower the person. One may go to check the door and ensure it is locked, but when you return to bed, once again start to worry about it. Then go to check the door again and return to the bed, but your worry still remains. So these recurring thoughts which make you feel anxious all the time and affect person's daily life in process are known as obsession. I remember, I'm recalling a case. It was a case of a sarpanch. He was having an ambitious case. I would be a block Samti member. So he was a retired principal, very reputed man and very responsible person of society. When he suddenly got some shock that his grandson died, and after that he started having, earlier his obsessions were very mild, it was manageable when he was in job. But after this event, his obsessions increased to such an extent that if he's sitting in the room and he will ask someone to switch on the fan. So if he is switching on the fan and some negative thought comes, he'll ask, then stop the fan. So it will take, as you know, once you start the fan and then switch off the fan, it takes at least 1-2 minutes to stop again. So he will ask now, once it stopped finally, and then he will start again, then now switch on the fan again. And this process sometime goes from morning till night, 6 hours, 7 hours, 8 hours. And they used to change the duty of a person, that there is a person who has to switch on the fan and switch off the fan. And this goes for 6-7 hours a day sometime. So if till he says that till that negative thought will not come again, I will keep on repeating the things. And he is so tormented about his behavior. So obsessions can vary. Some people are obsessed with cleanliness and may worry that their hands are germ infested, even if they washed them less than a minute ago. So these are the obsessions. Compulsions, people with OCD experience severe anxiety and distress. To relieve this anxiety, they perform repetitive action. So some of the obsessions are cleanliness, right? So these few terms will come repeatedly. Orderliness. So to relieve their anxiety, they have to rearrange books. I remember one of the dentist boy, he said that I always keep on counting the street light and everything I need in pairs. So if he'll buy a pair of shoes, he'll buy 2 pair of shoes. If he has to buy a car, he will buy 2 cars. If he has to buy a mobile, he'll buy 2 mobiles. If he is going through the road, if it has to be 1 street light, 2 street light, it has to be an even number. Odd number is not acceptable. Might be he has to take a turn for 10 kilometers, but he will have to have everything in pairs. So that is the kind of obsession, hoarding. So they keep on not throwing a thing, as we know it is in sulfur, but it can be a OCD symptom that they collect old newspaper, clothes, even the collection of coins and stamps. Sometimes they are obsessed persons. Counting, they have a ritual of counting. So they keep on counting the things. I'm a bit fast now, I'm not repeating. Safety, the insecurity can be, as we sometimes relate it to the arsenic, to the thuja, to the calcarea cup. We take sometimes this insecurity can be a symptom of obsessive compulsive disorder. So what are the diagnostic criteria? As you know that International Classification of Disease Manual 10 is the currently used the criteria for the diagnosis of any disease. So they say that obsessional symptom or compulsive act or both must be present on most days for at least 2 successive weeks. So if someone has got these kind of symptoms and they are persisting for more than 2 weeks, to be source for distress or interfere with daily activities. And obsessional symptoms should have following characteristics. Number one, they must be recognized as individuals' own thought or impulsive. Means you are not asked to do. It has to be your inner urge to do those things. Second, there must be at least one thought or act that is still resist is unsuccessful. Means you have certain thoughts which you are fail in controlling them. Then third is the thought of carrying out act must not in itself be pleasurable. If someone is enjoying a certain thing, as I mentioned, supposing the sexual things or watching pornography, sometimes watching pornography is also a symptom of OCD. But the ruling out between the disease and habit, disease and addiction, sometimes alcoholism or drug addiction is also categorized under the this category. But the only difference is one should be asked that you enjoy the act doing again and again, say masturbation. If someone is masturbating but is enjoying that masturbation, then it is not an OCD, then it's an habit. So you have to understand this. So it should not be like the stress relieving gesture. The thoughts, images, or impulses must be unpleasantly repetitive. So this is the diagnostic criteria issued by International Classification of Diseases, which is actually acceptable by the allopaths, because when they do this medical reimbursement or the insurance company, when they take a case, so this is the diagnostic criteria they take. So treatment and medication is most effective treatment for OCD or cognitive behavior therapy. This is called CBT, and specifically this CBT is taken as exposure and response prevention, ERP. I'm not talking on this, you can search it. Then which are the strongest evidence supporting its use in treatment of OCD? And medication is serotonin uptake inhibitor, SRIs are the group of medicine which are prescribed along with other symptoms. So now I'm coming to the case. This was the introduction part. I'll be exploring more of OCDs, but for the fear of getting it too lengthy, so I have concised the presentation in the form of presenting some case and then taking some theoretical part so that it won't get boring for you. So cases and homeopathic approach. The first I am presenting you a case of 27-year-old female. She is suffering OCD when this lady came to me in 2013 or 14. So for 3 years, she was suffering this obsession of washing hand frequently. She had pimples on the face, more on left side. She has eczema on hand because of this washing hand of antiseptic soaps and washing soaps. She has developed an eczema on the hand, and she has a symptom of headache which aggravates by the stress. Thermal and thirst, she is hot and sometimes feels thirsty, but not clearly very thirsty. She likes covering and can tolerate cold more than heat. So she's more of a hot patient. Physical journals, appetite is normal, hunger is tolerable, craving normal, nothing specific, stool normal. So there's no, this is one of the feature of OCD patients, that there are hardly any physical symptoms. This is called paucity of symptoms. You hardly get, because, and the irony is that I'll come to that also. Sleep and dream, no specific dreams. Sleep is a bit less because of his anxiety levels are high. Menstrual history is menses normal, cycle for 5 days. Menarche at the rate of 13 years. He was studying in 7th class when she started with her menstruation. So menses are regular and not painful. Family history, that mother also had OCD, and she has suffered typhoid 2 times in her early age. Now she is 27, but before marriage she has suffered typhoid twice. And hypothyroidism, mother also has hypothyroidism. So Mental Journal, she says that my problem started in 2011. It started with frequent washing of hand again and again. So I was wondering that why I'm doing this. Everyone started mentioning me that are you mad? Why you are washing hand? And see the behind the curtain, what happens that I say why you wash hand. She said that I have fear of snakes. So she is living in Canada only. So I have taken this case voluntarily. So no, she's in US, sorry. So she says that she has a fear of snakes. I feel if I touch some place from where snake has crossed, or someone else has touched that place and then touch me, and then I will become dirty. She says that supposing I am touching something, suppose if there are snakes around, and if someone supposing someone has touched that place from where snake has crossed, and now that person will touch me, so I'll become dirty. And then, like in India, she says that if anyone is making roti on chula, or there is cow dung with wood near chula, chula is the stove, then I can't eat that food over there because I feel snake must have crossed that place. Like one of my relatives, when going to India, make food on chula means stove, and now whatever thing she touches, I feel it has become dirty. So she said that 4 years back, my one of my babi or Nanad, she has gone to India, and there I asked her that you were in the village, so how you cooked the food? She said that we used that fire sticks and cow dung cakes to cook the food. So she said, you have cooked that way. Okay, so then you must have touched some cow dung cakes, and that must have been touched by a snake. So even after 4 years, whenever she comes to my house, so my relatives, so I feel that she's a dirty lady, and I never touch her things. And now my relative is in US, so she's also stays in US for so many years, but still I cannot tolerate her presence around me, because she has once gone to India and cooked on the chula. I used to get anger whenever such kind of person come to home. So I cannot allow these kind of persons to come me. So otherwise, she said that husband is very supportive. So she said that when I get angry and my face get red during anger, I like to sit under sun. I don't like contradictions. In morning, people take God's name, but I start thinking of my problem. She says my day starts with thinking about my disease and checking everything. Okay, snake has not. She says there are no snakes. I've never seen snake in my vicinity in US, but still I check, cross check, and again whenever I go, I check, is there a snake around? My nature, otherwise, she says, good. I am a person who enjoys life. I never keep something in my heart, and I tell it straight away on their face. So whatever things I have, patient was talking by herself. Say, I like to talk, can't remain quiet. And I feel better after sharing my inner feelings. She says that I feel better after sharing my inner feeling. When in anger, always expresses it. Can't tolerate anyone's wrong words. When no one understand my problem, then I think I'm alone. And I feel alone when someone, because she's repeatedly talking the same thing and same thing. So sometimes people ignore her, then she feels that I'm alone in the world. I like going out like Canada, London. So she said that I love traveling around. I keep on going at different places. But still there, that thought of snakes is always there. So behavior with friend and relatives, this is a question I usually ask with people to understand their nature. I never ask that tell me about your nature. So I always ask that, tell me about your relationships with your family and your surrounding people and relatives especially. So she said that I have friend circle, but very choosy in making friends because I observe them for a long time and then I make friends. Likes to dance in parties if insisted. I don't like much meeting with relatives. I don't want that relative should come at my home, but if she comes, wherever she touches after she leave home, I wash all those places. After she leaves the house, I used to take bath. So this is now the case in front of you. Now, I would like you to, if possible, you can type in the chat box. So I would, for 1 minute from now, I would love to have your uh, questions. Dr. Sharma, please, Dr. Bhupinderji, you please keep noting those questions as someone is asking about first ADS nature. Otherwise, most of your such queries will be already answered into the presentation. So don't jump to the medicines. Tell me the approach. No, not rubrics. Tell me how will you proceed. So what is in this case to be taken into consideration? Okay, suspicious you can take. Otherwise, what is more important? Like I says, don't jump to the medicines. I'm not asking about the medicine. Okay, delusions. What are the delusions? Fear of snakes. Okay, fright, extrovert. What else? Talkative. Okay. So if someone can concise that what medicine, what we need, because I'm going to the next slide. Okay, thank you. We need to establish the relationship between fear, of snakes and our OCD complete. Okay, that's interesting. Anything else? Delusion, dirty, fear of disease, delusion alone, dirt aversion, loquacity, right? So 1 minute is over because I have long journey to go. So thank you for your inputs. So I would proceed with now my presentation. So my question was, what according to organon of medicine, how should we proceed? Because aphorism 3 says that if a physician clearly perceive what is to be cured in disease, so we need to cure the disease. Okay. That is to say, in every individual case of disease, because in aphorism 72, Dr. Hahnemann says that when we start the case taking, we take the individualization of the case suffering from the common disease. So what makes this OCD patient different from other OCD patient? That is. So summary of this aphorism 3 is that knowledge of disease indication, knowledge of medicinal powers, choice of the remedy, and proper dose. These are the things which I need. Then he understand how to treat judicially and rationally. So going on, again, the knowledge of disease. There are some remaining parts. I will touch that before I conclude this case. So this is what the OCD cycle is. There is an obsession, then that leads to compulsion. Then this reinforced behavior therapy is given. So then again, temporary anxiety reduction. Then obsessive compulsive again gets strengthened. There is any stimulus, any thought which comes again, that lead again to anxiety and then obsession. Another cycle is that compulsion comes into the doubt that again negative reinforced cognitive therapy, because when you behavior therapy, I'm not going into the detail. So these stressors, psychodynamics, immune dysfunction, hormonal change, weather, diet, family or origin issue, all these things might trigger the anxiety. Doubt might trigger the anxiety. Any other external thing can trigger the anxiety, which leads to obsession and then compulsion. This is the cycle which goes on. So most people, can you clear that annotation, Dr. Sharma sir? Most people have obsessive thoughts or the compulsive behaviors at some point in their lives. But that doesn't mean that we all have some OCD. So then again, coming on to here's one way of think about what having OCD is like. Imagine that your mind got stuck on a certain thought. Then this thought or image got replayed in your mind over and over again, no matter what you did. You don't want these thoughts. So you are suffering from some thoughts. They are coming again and again. Dr. Sharma, can you clear this annotation from screen? Okay, thank you. I did it myself. So along with thoughts come intense feeling of anxiety. There is an anxiety. Anxiety is your brain's alarm system. When you feel anxious, it feels like you are in danger. Anxiety is a kind of parasympathetic reaction. Anxiety is your system going into fight or flight reaction. So whenever you feel anxiety, means there is some insecurity or danger. So anxiety is an emotion that tells you to respond, react, protect. So do something. Then on the one hand, you might recognize that the fear doesn't make sense, doesn't seem reasonable, yet it still feels very real. So you can talk to yourself as in anacardium. You talk to yourself, most of the remedy, that's why will contradiction is a common symptom in those OCD patients. So they are fighting with themselves. So it doesn't seem real, but you can't help it. Then why would your brain lie? Because your brain creates a situation, as is in this case, snakes around her. There is no snake. She has never seen snake in her 5 year stay in US. But still, it's an imaginary thing. So the brain of OCD people, they start lying to them. Why would they have these feelings if they weren't true? Feeling doesn't lie, do they? But unfortunately, if someone is having OCD, their brain do lie. If you have OCD, the warning system in your brain is not working correctly. Your brain is telling you that you are in danger when you are not. So this is the thing which we need to treat. We need to address that it is not about the snake. Supposing if you, what happens is allopaths, they do that reinforced therapy. They will show some videos that they will try to overpower that fear of snakes. Supposing even if with the therapy, the person succeed in overcoming the fear of snakes, still he will end up getting some other thoughts. So other thought will start intruding. So it would not be a snake, it would be a lizard or a cockroach or even some mobile. I had once a patient, she had that fear that this white light means that LCD lights which are being used, white lights, they are harmful to me, and whenever there is a white light, she gets that obsession and she wants to run away from that. So she'll get panicky after that. So this obsession and compulsion are like two hands which go side by side and they are fighting your two hands. So common conception, obsession in the mind because of this insecurity. If it is insecurity that body fluids, urine, fishes has touched. So as in this, that the snake has passed through something, she has touched it, and now she has come to my home and touched my bed sheet. So my bed sheet has been touched by that snake. So that same way, that because why I'm taking this again, already I've talked, because in this COVID time, this number of those people who had that OCD trait in them, it has sparked like anything. The number of OCD patient reporting to your or the allopaths has increased. I had talked with one of my psychiatric friend. He said that yes, Dr. Singh, you are right, that number of OCD patient in our OPD has increased after this COVID, because that fear of germ was at its ever high in last 200 years. People used to say, and I could relate, most of our religious obsessions like too much cleanliness, and in Hinduism and Sikh, we have that sutak kind of thing, that after a girl has delivered for 40 days, she is not touched. And those people who were in lower occupation, they were called untouched. The reason is again some kind of obsession. Might be at earlier time there were so many epidemics, so people doing that lower jobs into the society, they were casted away and they were thought that they will contaminate us. That's why we see the different wells and the different places to sit, and this kind of, might be there is some kind of these OCD traits which has given birth to these things. So body fluids, urine, fishes, germ, disease, herpes, HIV, environmental contamination, asbestos, radiation. Before that, I understood this OCD. I used to miss this kind of cases. A boy came, she said that I went to Thailand So although I have not done any unsafe sex over there, he has not touched a girl over there, but still he says that I have returned from Thailand, and that's why I might have got an HIV. And he has got it 100 times checked. Always its report is negative, but still that even a negative report for HIV is not sufficient to throw this thought out of his mind that he is not HIV sufferer. So he is keeping on roaming around for the doctors, and ultimately I could solve his OCD with the indicated
अच्छा
remedy.
वो कह रहे थे कोई connotation को remove करना है, वो कौन सा करना है?
सर हो गया वो, उसकी जरूरत नहीं है अभी. So unwanted sexual thoughts, forbidden or perverse sexual thoughts, images, forbidden or perverse sexual impulses, obsession about homosexuality, sexual obsession involve children or incest, obsession about aggressive sexual behavior towards. So this again is a very rising incest kind of things, brothers, sisters doing sex, or people with OCD forcing their mothers or their daughter-in-laws to have sex with them is kind of, although they are good people, but this kind of thoughts, this is again a very big social issues these days. I get many patients like that. Then another common obsession is OCD is that I will talk something or I'll say something which I should not say. So fear of losing the control over the speech or the thoughts, fear of acting on an impulse to harm oneself, fear of acting on an impulse to harm others, fear of violent or horrific image. So these are the common symptoms with which the patient report us. That's why I'm doing a bit of detail. Another is that what we call is blasphemy. So that is religious obsessions, concern with offending God. And so the one patient which approached me once, he said that I was very religious, but now whenever I go to the temple or when I see the Hindu goddesses, so I have thought or dreams like having sex with the pious goddesses. So he doesn't want to live. He knows that these thoughts are not good for me. I cannot handle these thoughts. I'm not such kind of person, but still these thoughts are coming to have sex with the goddesses. So concern about blasphemy, excessive concern with right, wrong, and morality. So these kind of thoughts. Then is harming, the fear of being responsible for something terrible happening. That fire, burglary, kuch galt ho jayega, something bad will happen. Fear of harming others because of not being careful enough, means dropping something on the ground that might cause someone to slip or hurt him. So they keep on clearing the roads. They will never throw the banana peel on the road. Otherwise, they have kind of obsessions to them that something, they will do something wrong. They will end up doing harming something. Then obsession relation to perfectionist, we all know the concern about evenness or exactness, concern with need to know or remember, fear of losing. Why I'm repeating these things is that knowledge of disease. I'm going to give you a great tip on this, that all these things, what should you consider in solving the case and what you have to leave while considering these cases. So fear of losing or forgetting important information when throwing something out, inability to decide whether to keep or to discard the things, fear of losing things. So other obsessions with getting physical illness or disease. So hypochondriac anxiety, people come Googling themselves, doing Google and YouTube, watching the videos and then coming to you with a lot of knowledge, unright knowledge, and then bothering you. They can be those situations. So superstitious ideas about lucky and unlucky numbers, certain colors. So all these things can be the OCD symptoms. So what are the commonest obsession of all time patients? The 40% of the patient, they come with dirt and germ. So that's why washing hand has been the most common symptom. 25% patient, they come with the thoughts of fire, death, and illness. 17% of the patient, they come with the symmetry and order. 13% have that religious obsessions, and 4% have unpleasant and aggressive thoughts of harming someone. Then what these obsessions lead to certain compulsions. The first most common compulsion is washing hand excessively or in a certain way, excessive showering, bathing, toothbrushing, grooming, toilet routine, doing other things to prevent. So they need to clean their body all the ways. Second is checking everything. This is so tormenting that this is the second obsession, most common obsession. Third is repeating the things, repeating, rereading, rewriting, repeating routine activities, going in and out of door, getting up or down from the stairs, repeating body movements, tapping, touching, blinking. So tapping is a very common obsession. That tapping, you see that in OCD, autistic patients also, they keep on tapping certain things, blinking, touching, repeating activities in multiple, doing tasks 3 times, 5 times, 7 times, 9 times, or in multiple, good and right, safe numbers. So these are where so many symptoms. Then mental compulsions are there, means even to prevent harm oneself or others. So they keep on praying, counting good or bad. So yeah, as I told that when switching on fan, if he get bad thought, then he has to stop that fan, and till that bad thought doesn't come, he has to do that work. He cannot divert themselves. You cannot abstract them. So putting things in order or arranging things alternate feeds right, telling, asking, or confessing to get reassurance, avoiding situations that might trigger your obsession. So the commonest obsession, earlier I told that commonest compulsions are obsessions, and now these are commonest compulsions. So 85% patient present with washing hands and grooming like issues. 48% patient again have these both symptoms. So they keep on checking. 38% do the rituals, and 17% the ordering is the major presenting complaint. So now coming back to that case, we have that lady who has fear of snake, who has compulsion of that someone has touched that snake, and she presented to us. So Dr. Henneman has talked about these kind of cases in under the heading of one-sided diseases, because you hardly get any symptoms. So aphorism 172 to 184, 172 aphorism says that similar difficulty in the way of cure occurs from the symptom of disease being too few. Means there are so many symptoms, and but they are too few, that supposing most of the OCD patient you get this symptom washing hand. And if you go to the art literature, so this case, coming back to this case, we have these symptoms: washing hand frequently, delusions rake around her, avoids food touched by others, fear of contamination, and feel things around her are dirty. So if I consider these symptoms into the mind, then we have this remedy as repertorization. So we know that washing always hands are as only 14 remedy. So as I show you a slide, that 85% or 70% of patients, they have this symptom. This doesn't mean that only 14 remedies will cure all the OCD cases, because if we have this is the latest rubric, we have washing always hands, mind, and we have only 14 remedies out of it. Arsenic, coca, curare, leccan, medorinum, merc, natramure, platina, sorinum, sepia, silica, sulfur, syphilinum, thuja. These are the remedies we have. So that doesn't mean that every case, supposing I repertorized this case, washing always her hand, delusion snakes in and around her because she's always looking for snakes, fear, phobias, general contamination, germs off. So this, if I get, that is the leccan, such a simple case. So how many of you agree that leccan would help? I would like comments that how many of you agree that if, because these are the repertorization totality in front of your screen, how many of you agree or disagree that if I give leccan, the patient would be cured? Kaushal Shah, don't agree, disagree? Yes, more inputs. I would love more inputs. Disagree. Okay. Agree. Okay. More. Disagree. Okay. Disagree. More disagree. Okay. That's great if you disagree, and that's great if you agree. My work like sorry. Okay. Disagree. Most of the people are disagree. Okay. Then what should we do? Because we have done the repertorization, the symptoms we got, this is how we practice. Agree. Okay, people are agreeing to that leccan, giving leccan would help this patient. Okay, that's great. So here's the twist now. I disagree. Why? I will give you. So why I disagree? Because in organ and of medicine, I think no is the disagree. The people who say disagree, I'm with them. Because if we read footnote 122, it says, thus aconite will seldom or never effect either a rapid or permanent cure in a patient of a quite calm, equable disposition. And just as little will nux vomica be serviceable where the disposition is mild and phlegmatic, pulsatilla where it is happy, gay and obstinate, or ignatia where it is imperturbable and disposed neither to be frightened nor vexed. Dr. Hahnemann Master says in a footnote 122 that even if aconite is coming prominently into your repertorization sheet, it will seldom or never affect in if the patient is a quiet, calm, equable disposition. And even if it is the full repertorization chart and maximum marks taking, still the nux vomica will never help where the person is mild and phlegmatic. A pulsatilla will never help a person who is happy, gay and obstinate, or ignatia will never help a person who is never frightened and who is imperturbable. So this is what Dr. Hahnemann say. Now coming on to Lacan. So in this case, the points in favor of Lacan are that is full of horrible imagination, snake, vermin. Yes, it is there in Materia Medica. We read the lengthy notes and we read the remedies that is said that it is full of horrible imaginations. Is there? It is one of the major remedies of Lacan in the washing hands. It has fear of contamination. So it classically fits the case. But on the other hand, there is no disposition like Lacan. What you see, Lacan is full of inferiority complex, no forgetfulness, no antagonism with herself. She is very clear that I don't allow these people. She is not at all the submissive kind of personality. She is not the kind of personality who is having her own, working according to her own will. So she is a different kind of personality. So how can we prescribe that Lacan to such a lady who is not like a Lacan? So this is the thing which we need to understand. So how to proceed then? Any ideas? Because we prescribe the man in disease, not the disease in man. These symptoms which we have considered for the case of Lacan, these are the symptoms of disease. Because washing hand is an OCD symptom. These kind of delusion, dirt around and harmful things are around is an OCD symptom. Contamination is an OCD symptom. So we need not to treat the OCD here. We need to treat the person. So what are the symptoms of person? So we have studied. So this is the glance that what we have to person, we have to find the personality traits. This patient is very choosy and feel other are inferior to her. But Lacan has a symptom that others are. This patient is very choosy, but Lacan personality, they think that everyone else is good. I am the bad. They have an ugly feeling. They have a strong inferiority complex. If this person is saying, I don't allow that lady to come to my house. I don't compromise. I'm very choosy in making friends. So she's contemptuous. She's saying that others are dirty. If you have cooked on the chula and you have tucked that cow dung cake, I don't eat from your hand. So feels better sitting under sun. So what is contemptuous is dictionaries tend to more or less equate contemptuous with haughty. Means this is a haughty constitution. Supposing in India, sometimes we get cases that mother daughter-in-law will say that doctor, I have married to these jahil people, these uneducated and low standard. Although they have a lot of money, but I hate them. I don't consider. So if someone is looking down upon others, he's saying I'm superior, others are inferior. So contempt usually refer to more a person's attitude to others. Haughty is I feel I'm right, but contemptuous means you are nothing. So although it may be said that having an unduly high opinion of oneself, hauteur necessitates having an unduly low opinion of others. It is clear that there is a difference between manifestation of each case. So haughty and contemptuous, if we compare, the truly haughty person puts himself so far above the level of others that even contempt for them may be below him. Means contempt, but where we use this word contempt is contempt of court. Say the authorities at court has ordered you to vacate a place and you are not vacating. So there's another case, means it is contempt of court, that court has ordered but you are not following. So that way you are looking down upon the court. So contemptuous person on the other hand gives clear evidence of his feeling with his scornful demeanor. Kant in fact refers readers to contempt under the rubric scorn and reserve the latter heading for those symptoms resulting from being on receiving end of scorn. So he equates contemptuous with despises, mocking, a ridicule mania to. दूसरों का मजाक उड़ाना, दूसरों को नीचा करके देखना, looking down upon others. So when we take this his consideration into the symptom, means she likes to travel, she is better under sun, and the person is contemptuous. The remedy comes under is the splatina. And if you see that washing always her hand, the platina comes in this rubric also now. Now we have approached the case from the different viewpoint, that we have considered that personality, not the disease. This is the major clue. If you take this lesson home today, you are done with a lot of understanding of homeopathy. In homeopathy, when you are treating the diabetic patient, so people, they prescribe acid phos, they prescribe lithium, they prescribe the remedies based on polyphagia, polydipsia, polyuria. No, my brother, it is not the issue. We need not to prescribe for diabetes. We need to prescribe for the person who is suffering from diabetes. So here the platina constitution is suffering from OCD. So we need to understand this thing, that when who is the person who is suffering, it is not the disease, it is the person to whom we need to cure. So I hope you got that. So prescribed was platina and patient started improving. So platina in OCD, they are very high-headed people, think everything is below them. So are very choosy in everything, want best thing for them, hardly compromise with people around them, even family and relative. They are hard to inferior, kind to superior, everything seems dirty. So this is a kind of platina which suits. And another rubric, if you go, I have very little time today. So if you go that pedant, if you go to the rubric pedant, pedant is who wants everything according to him. So that way, the pedant is another platina treat. You go to read this. So everything seems dirty is the platinum. So follow up this case later on. I prescribed the first remedy. Then one of my colleague or students, he's in Australia, or sorry, he's in US. So he's handling this case. I talked to that lady last week. And because I was making this presentation, so I wanted that she came to me in 2014. And now this is around 7 years when I'm presenting this case. So she's much better after long follow-up. Her OCD returns slightly when she's under stress. So that is how homeopathically we can solve these cases. Now, next, let's learn more about OCD. So I have passed the 2 stages of my presentation. Now, next stage is more of practical part. So what are the sign and symptom? Signs of OCD usually become apparent in childhood. I remember once I got a patient, it was around a 6 years old child. They went to watch a movie and parents thought that this movie we can carry the children around. So it was a kind of movie which was having adult content in it. and that boy saw all that on the screen. And after returning, he started that everything is dirty, everything is sab ganda ganda lag raha hai. I'm feeling everything is dirty, dirty, dirty. His grandfather also having the OCD. So this is sometimes we see these symptoms in early childhood. It tends to begin slowly and become more intense as they mature. For many people, symptoms come and go, but it's usually a lifelong problem. So sometimes they appear for a while, and then after in the growth period, they have other issues and they forget it. Then it returns into the teenage. Once I got a patient, she said that it is for the fourth time she is suffering from OCD, but this time it has worsened that earlier she was sexually assaulted, and then in teenage also she shifted to the Australia, and there his real chacha tried to molest her, and at that time it returned. Then after marriage, her husband forced her for the abnormal sex, and at that time it increased. And now her son has done something, tried to touch her personal parts, and then it has returned. So sexuality and OCD, they always come. So all the time it has been remaining there for around 3 months to 6 months, but this time for 2 years it is staying there, and then we needed to treat that lady. So then it becomes a lifelong problem. Sometimes it comes in episodes, and then it becomes a regular issue. So in severe cases, it has a profound impact on quality of life. Without treatment, it can become quite disabling. So social signs, when you look with such kind of hands, tattery hands because of overwashing. So people sometimes mask their behavior. If you see someone who is nervous, who is seemingly hiding something, and you see their hands are like this, so you can start talking from there. For others, social situation trigger compulsions, something you might notice in a person with OCD. So avoidance of certain situations. So when a person is suffering from OCD, most of the time he start avoiding certain situations. Intense anxiety when things are neat and ordinary. So you have CDO, it is not that OCD, but all the letters are in alphabetical. So they should not say that the letter should be A, B, C, D, O, not O, C, D. So that kind of compulsions. I hope you understand. So need to check the same thing over and over. We have repeated this many times. Counting for no reason or repeating. At least an hour each day is spent on unwanted thoughts or rituals. Constant need for reassurance. Now, this is again a very important topic, that children and OCD. So since OCD often begin in childhood, teacher may be first to notice signs in school. You can talk to the teacher. A child who is compelled to count, for instance, may not be able to complete the ritual. So he's doing the scenes again and again, repeating. Say he'll count 1, 2, 3, 4, 5. So whatever you teach, he'll never jump to the 6. 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. So they'll keep on doing. Stress can cause any angry outburst and other misbehaviors. So when you stop them to do, they show misbehavior. One who is afraid of germs may be fearful. I get many patients these days. So the mother says that doctor, he is so fussy. I taught him that you should wash hand, but it is not. Now it is around 10 years child, and always. So she said that I myself taught her to be into the hygiene, but now I'm bothered about her hygienic habits. So a child with OCD may fear they are crazy. Obsessions and compulsion can interfere with schoolwork and lead to poor academic performance. Children with OCD may have trouble expressing themselves. They may be inflexible or upset with the plan change. So they need the things. This is common with all the autistic and OCD patients. If you ask them to change the plan, no, it is very hard for them to go out of routine. They are so routinists. Their discomfort in social situation can make it difficult to make friends and maintain friendship. In an attempt to mask their compulsion, children with OCD may withdraw socially. Isolation increases the risk for depression. So this is what you can look for. A bit fast, I know, but I want things to finish today itself. already 8:35. So we have 40 minutes more, na, Dr. Bhupinder?
Yes, 40 minutes. Yes, you're right.
I hope all are comfortable. I'm not bothering you, your mind pressurizing too much.
No, we are happy.
All are getting me?
Yes, we are getting you, Dr. Muktinder. Yes.
Okay, I'm able to convey myself or communicate with all, na?
Yes.
Right. So there are many comorbidities where OCD can be a symptom just. As patient with OCD, that depressive patient may develop OCD. Bipolar order disorder, the people in the hyper phase are not bothered about hygiene, but in hypo phase, they are hypomania, they are bothered about this kind. So many a times they become OCD patient, many a time they are not bothered. Psychotic disorders, eating disorders, so they can be eating disorder. The lady, she said that I cannot, because I end up eating so many things, I'm trying to lose my weight, but this is not helping. So it was an obsessive symptom. So same way, difference between autism, if you have autism, so there are commonalities. Means obsessions in OCD are aggression, sex, religion, contamination, symmetry, somatic. While in autism, they are holding, they keep on holding a particular toy, a particular cloth, a particular thing. They always keep holding it, need to know. So, and behavior wise, OCD, obsession and obsession, compulsions. OCD have cleaning compulsion, checking compulsion, counting compulsion. While autism, they'll represent more of repeating or repetition, ordering the things, holding and touching and self-damage. So you have to be very cautious in labeling a child, whether it is autistic or obsession OCD child. So you need to be very clear in forming because many OCD patient has autism also, and many autistic have OCD also. So the ICD classification says that you have to fit into the criteria. So what are the major diagnosis has to be taken. So here the autism would be taken as the first diagnosis, autism with OCD. You never get an OCD with autism, because autism is a bigger disease than OCD itself. Same way, ADHD child and OCD children, they have many commonalities, because ADHD has impulsivity, short attention span, poor planning skills, time blindness, depression when underestimated, little sense of danger, making careless mistakes, no motivation for tasks you are not interested in, auditory processing difficulties, uncomfortable maintaining eye contact, emotional dysregulation, interrupting conversation, lack of subject, and OCD as obsessive thought unwanted. We have been talking this for last, but stimming, hoarding, self-harm, talking a lot, sensory issues, sleep problem, intense emotion, hyperfixations, rejection sensitive, execution, dysfunction, poor working memory, finding it hard to make friends. So these are something which overlap between OCD and ADHD. So while labeling a child, you have to be very cautious and understanding in both the disease separately, and then you have to understand. Now, there's a bit of something which I would definitely not like to miss here, is how OCD affects our brain. So these are the areas of brain, these logic areas. So it has two, either these three etiologies: neurobiological, environmental, or psychological. So neurobiological is there is a serotonin excess into the system. So OCD neurotransmitter level, what happens is it has a neuroimaging studies show that brain function differently in people with disorder, and abnormal or imbalance in neurotransmitter means serotonin is thought to be involved in OCD. Serotonin, what is serotonin is, it is 80 to 90% of serotonin is in GIT. Now it's true for the autism also, it is called the gut disease. Same way OCD is serotonin is mostly produced in the GIT. So it is used inside the brain, must be produced within it. So it is thought that serotonin can affect mood, social behavior, appetite, and digestion, sleep, memory, and sexual desire function. So all these things are affected. So say, supposing I am doing one thing, I made a presentation, I'm talking, but I asked with Dr. Sharma, whether I'm able to communicate or not. But if their answer was that, okay, it's okay. Now I'm moving on. But if supposing my brain stucks over there, that logical mind that, okay, I have got the answer means they are satisfied. But if this thought keep on tormenting me, so that's what the serotonin does. Serotonin keeps me moving ahead. So if I'm not able to move ahead, I'm not able to kill that thought into my mind. So neurotransmitter level, we have talked about serotonin. The MRI study says that decreased size of caudate nuclei, the picture I showed you earlier, and increased activity in frontal lobe. So caudate nuclei, they get the less blood supply, they are less active, and frontal lobe and basal ganglia, they are more active. And in genetics, it is said that OCD runs in families and can be considered a familial disorder. The disease may span generations with close relatives. And OCD, people with OCD significantly more likely to develop OCD themselves. So if they have your family history, there's definitely more chances of OCD. Some biological theories suggest that a lack of brain chemical serotonin, as we have talked, has a great role. However, experts disagree about that role. So this is what Dr. Hahnemann has asked homeopaths to restrain from these speculations. We have to treat the person, not that serotonin. What they do is they try to make up, they try to give the serotonin uptake. So they SRIs, serotonin release uptake medicines, and they try to control. But OCD cannot be controlled. It just comes under control for some time, but internally the patient suffering keep on increasing. So now, psychological issues, definitely we all know that stress can be the major cause. So behavioral theory suggests that people with OCD associate certain objects or situation with fear. So fear is one thing. So sudden fear due to any situation. I have seen that most of the girls who develop OCD in their late teenage, the reason behind is early childhood sexual assault by some of the family member or some person into the family, because they feel dirty. So any fear, dominating father. I once had a case of homeopath whose father was very dominating. I treated that case with conium because though that homeopath was punished badly. His father was a military man. He used to, even to torture them, he used to put rod into their anus. Both this brother, he was used to pain. His anus used to bleed due to his father putting rod into his anus. So that was a kind of punishment his father used to give. And that person developed the bad OCD. His career was ruined. And with conium, he started improving, although he was never totally cured, but conium helped him a lot. So behavior therapy, they learn to avoid those things, to learn to perform rituals in order to help reduce the fear. This fear and avoidance of ritual cycle. So this is of two types. When they treat it, I remember one of the boy who suffered OCD. He was admitted into the PGI for almost 4 to 5 months. He had touch impulse. So they used to have a negative reinforcement therapy to avoid his touch situation. They created a special room. He was left in that room where everything except 2 or 3 things which he was supposed to use for his food, everything, there was a current. So whenever he used to touch anything, there was a current. So his mind was given a negative message that if you touch anything, it will be current. He has internal impulse of touching something, but outside feedback is that if you touch anything, you will get a shock, electric shock. So that even it relieved for some time, but his OCD was never cured. So this kind of things they do. So may begin during we know that this fear and avoidance or ritual cycle may begin during a period of intense stress, such as when starting a new job or when a relationship comes to an end. Once the connection between object and feeling of fear becomes established, people with OCD begin to avoid that object and fear it generates. So supposing I used to talk my patient that supposing to avoid thought is like that if I give you a pen and I ask you that whenever you open this pen, the cap of this pen, you make it a point that you don't think about monkey. And always remember this point, that you should not remember the monkey while opening the cap of this pen. And you have to open this cap after 1 hour every time. And every time you open, you keep it in mind that you don't think about monkey. You all know what will happen. That if he remember my instruction, that don't think about monkey, by not thinking about monkey, he is ultimately thinking about monkey. So this is what happens into the mind of OCD person. For example, a person who is caring for an infant and who is under intense pressure may have an intrusive thought of harming the infant. Whether that, we all know that hyper self symptom, that she will throw her own child into the fire. So that is an obsession symptom. Whether that thought is of intentional or unintentional harm. So most people can shrug off and disregard the thought. So most of the people, if you get such a thought, supposing someone is shaving the person and he gets that cutting the throat of the person to whom he is shaving, and then he will just throw off that thought from his mind that no, I don't have to do that. So this kind of a person suffering from OCD may exaggerate the importance of the thought and respond to thought as it signifies a threat. As long as the sufferer interprets these intrusive thoughts as cataclysmic and true, they will continue the avoidance and ritual behavior. So this is what happens. And another third part is that environmental successor. So environmental successor may trigger OCD, that is traumatic brain injury. Sometimes some persons, they suffer OCD after head injuries. So in adolescent and children has also been associated with increased risk of onset of obsessive compulsion, with one study finding that 30% of children ages 6 to 18 who experienced a traumatic brain injury developed symptom of OCD within 12 months of the injury. Overall studies indicate that patient with OCD frequently repeats stressful and traumatic life event before the illness begins. So it can be the physical injury as well as the mental injury, the shock or some event which has definitely affected. So early childhood conflicts, early theory that suggests conflicts or problem during childhood are the root of OCD. So as I told you that sexual assault at early age, domination at early age. So this is specifically looking for either permissive or mainly uncaused parenting techniques. So sometimes the parents are not understanding, they are pressurizing the child for studies, they are putting undue pressure for the performing and comparing their children with others. So this kind of situation might trigger the OCD. So major life transition, stressful events. These days, I remember some of the kids, girls or boys in their teenage, when they are choosing for their career, they are in a stress of choosing the right career. They develop this kind of OCD situation. So this can trigger stressful events such as traumatic event of losing a loved one. So breakup in the relationship that can cause, or bad marriage can cause the OCD to trigger. So what are the complications? People with OCD are also at increased risk of other anxiety disorder. So anxiety disorder can lead to the suicide impulsive. The next test I'm discussing is of the same thing. Now, one more thing, I'm now going to another level. So there are different terms. One is OCD, which we are talking about. Other is obsessive compulsive neurosis. And third is obsessive compulsive personality disorder. So there are, what you need to know is there are four type of, these are 6 type of neurosis. Anxiety neurosis, we know, depressive neurosis, and there is one is obsessive compulsive neurosis. And somatization, which is hysterical neurosis, and PTSD, post-traumatic stress disorder, or combat neurosis, and compensation neurosis. So it can be the one form, one is neurotic personality, might have this kind of thing. And other is, other term which I used was OCDP, that is obsessive compulsive personality, obsessive compulsive disorder personality. So this OCPD means that there are 12 type of personality type: avoidant personality type, passive aggressive, narcissist, hysterical, cyclothymic, dependent, avoidant, paranoid, antisocial, addictive, borderline, and schizoid type. So this can be the one of the personality type also. So obsessive compulsive personality disorder, what does it mean is This is not the actually OCD. So these are the people around us who are very perfectionist in nature, who are not actually the OCD patient. This is a personality type, as I told you. I'm not going into the detail. You can explore it yourself, and it needs an independent lecture on this, that what are the 12 personality types. So this obsessive compulsive personality disorder, OCPD, is characterized by pervasive preoccupation with orderliness. So these are the people who are principals, who are the administrators, and control with no room for flexibility. And that ultimately shows interfere with completing a task. They can be very successful people in life. Now, this OCPD can be the successful people, can be the jailers, can be Hitler was an OCPD. So familial trait of compulsivity, restricted range of emotion, perfectionism are thought to contribute. So signs of obsessive personality disorder. They are good in organizing things. They are perfectionists. They have attention to details. They frequent list making, as in argentum nitricum, you see, they makes the list for everything. They are very rigid. They are not at all flexible. So they are great devotion to work. They are very diligent. Their social isolation, formality, there are a lot of formal fragility, hoarding. So these are the personality disorder traits. So they have difficulty delegating responsibility and tend to take on more work than is healthy. So what they end up putting more pressure on themselves. They are taking everything on themselves because they don't really trust others to get the job done properly. For this reason, they may avoid working in teams because they believe others are too careless or incompetent. This makes them suspicious, mistrust, and guarded. Now, you have to clearly understand the difference between OCD and OCN, and these are the similar terms, but OCPD, personality disorder, is a different term. So I hope you understand this. This is very important, that OCPD is not OCD. OCPD is a personality type. Personality. There are 12 types of personality. So this is one of the personalities. So these people, they are rewarded in Western world. These are the people who are much needed into the military and into, they always gain the high position because of their dedication to work, because these are the scientist people. These are the people who are Nobel Prize winners because they are so single-headed, there's monomania kind of thing, that one thing, only one thing, no emotions, no diversions, only one thing. So it makes them a successful people in life, although they are not good in relationship, although they are not good. So you should not confuse this OCPD with OCD. So what if you don't treat, but if you keep the OCD untreated? So it can lead to depression, it can lead to lack of peace of mind, it can lead to damage personal and professional relationship, it can lead to physical illnesses, it can lead to anxiety, panic attack, it can lead to substance abuse, it can lead to time and energy loss to compulsion, it can lead to missing school or work. So these are the complications which can be seen. So now I'm again coming back to the homeopathy. To solve cases of OCD, we have to stress upon number one is ailment from, as I told you, that person was having that the ailment from punishment, ailment from domination, ailment from love, disappointment. So this any strong emotion which has come, it can be the fear, it can be the excitement, it can be the joy, it can be the hatred, it can be the jealousy, any emotion when it overpowers, as in Hypochondriac, will read that Hypochondriac, they get OCD from jealousy only. So major events in life when disease started, as I told you, that girl in childhood when was sexually assaulted, then her husband forced her for the abnormal sex, then her son has now tried to touch her private part. So these are the particular events which has triggered the OCD in her life. So triggering factor we have to, and above all is the miasmatic background. That is very, very important. So we can think of having a psoric OCD patient where it is only the personality trait. not the disease itself. Psychotic, where the person is hiding and fear of losing control and having some certain, I've not made this slide, but in syphilitic, which is out of control when the person is self-harming. So it can be tri-miasmatic also. It is not always syphilitic. So these are the symptoms. You can take a screenshot of this, that ailment from responsibility. So these are the common symptoms which can be thought of for OCD patient, because these are the common traits: anxiety, anger, avarice. Because avarice is again a kind of OCD. The people having sufficient money but not spending it, holding on to the money. So these people, they become very rich ultimately, but their OCD, जिसको हम पंजाबी में बोलते हैं मक्खी चूस, कंजूस मक्खी चूस. So they are obsessed with the money. They don't even give it to the. I remember one of the our self-flavum patient. He was having a lot of property. He was having government job. He was having his own petrol pump. He was buying the land. He has inherited only 15 acre of land, but now he's having 250 acres of land. He has multiplied his land like anything. But if he said that I have decided to divorce my wife. Okay, for what you have decided to divorce your wife? He said that she's asking for money. She asked that for children she needs pencil, pen, and she daily asks me for rupees 10. A person having 250 acres of land and is not ready to 10 rupees to, not ready to give 10 rupees to his wife and his son. Such an obsession for the money. So he was treated with the arsenic sulfate because of that avarice and his looks. He was always coming up very suited, booted and all that. So that way, you have to understand the personality in the. So some personality pictures I'm showing you. Arsenic album in OCD. So arsenic suits the thin, highly anxious, melancholic temperament, ambitious driven, fastidious perfectionist, who's all very concerned about orderliness, cleanliness, tidiness in outer appearance. So this is what arsenic will present as. On the inside, they are insecure. So they compensate with an anxious, hasty restlessness, which drive them from place to place. They desire companionship and are aggravated when alone, but they are easily offended, censorious, critical, fault finding, which drive people in. Har baat pe nuks nikalna, not happy with anything. They do not want to see the persons they believe they have offended. So they may be malicious, spiteful, and vindictive. Kalika OCD. Kalika patient has lax fiber, obese makeup of the body. They are inwardly timid and apprehensive about the future. So they compensate this by being dogmatically conservative. Very much dogma, very much strong, very much rigid, very much non-flexing attitude, demanding that everything is done properly according to their rigid standards. This is what Kalika is. They are fearful when alone and wish to work with people, but then they treat them outrageously. Patient is whimsical, irascible, irritable, and quarrels with his family and his bread and butter. This is what Kalika is. I'm a bit fast. Please pardon me for that, because I have not even reached the half of my presentation. So I'm a bit fast now. So prejudices. Arsenic, calcarea, Kalika, black cyst, lycopodium, the platina. So they have the traditional prejudices. The work should be done as I want, as I know. So they won't, even if you have to follow them, carry them to the hospital, you should take the same turns they take. Go to the first right and then the third lane. Maybe it is a shortcut, but no, they know their way. You have to go their way. So that is what they are full of prejudices. So Nux vomica OCD will be is well adapted to thin, irritable, careful, zealous persons with dark hair and choleric and sanguine temperament. Patient is workaholic, who is driven by strong ambition and expects everyone to work as hard as they do. As you say, they say that, look at me, I have made myself, I have self-made man. So why my son is not going to the shop at the time? Why he is not doing according to, why my wife is not taking care of, why my son-in-law is not doing as I have done in my life. So when others do not live up to their demands, they become impatient, angry, abusive. Next is carcinosin. I've tried to give you some pictures. There, every materia medica can be written in this way. Carcinosin patient is fastidious about personal relationship, duty, responsibility. They are very sympathetic and try to do best for others, but then suffer disappointment when others do not live up to similar expectations. So Aurum patient is very religious, very responsible, very industrious, and then again, guilty conscious is at the root of Aurum patient. I have many Aurum patients who suffered OCD and they have been treated by either of Aurum Met, Aurum Neonatum, Aurum Iod, Aurum Sulf. So they are great remedies for OCD. So their mania for work is an excessive coping mechanism they use to repress the underlying delusion that they can never succeed in this world. Aurum has a delusion of worthlessness. They always feel they are not successful. So when whatever position they reach, they still feel that there is lacking something. They have not lived up to their potential. So when the high moral and financial goals they set for themselves become unattainable, they become melancholic, depressed, and suicidal. So lycopodium patient is sycophantic and survive. Those in authority, so hard to inferior and kind to superior. We have 4 remedies: lachesis, lycopodium, platina, and veratrum. So all they can make the good OCD patients, and dogmatic with those over whom they assert control. Lycos make great pretty tyrants who are critical, domineering, overbearing, haughty, and bossy. So we know that lyco are bossy, but they are submissive too. This tendency is based on lack of confidence and mistrust of people, which make them believe a good offense is the best defense. Love for power, we all know. We have arsenic, lachesis, lycopodium, nux vomica, sulfur. So this can be a great OCD trait. Nitric acid, very obstinate. I remember a girl to whom I treated. So she sometimes present with the OCD symptoms, but she had developed some ulcers on her particular point. So when I repertorized by the side of ulcer and location, I got nitric acid. And then I asked the parents, does she hates anybody? She said no. So then I asked that whether there is something which is always stuck to her mind. She said, yes, doctor, we were hesitating to tell you that since this ulcer has developed, she is very insecure. She once saw the parents in sex act doing sex, and she thought that father is hurting mother, and since then she is never able to see her father and mother together. She make it a point that they never get together, they never even talk, even eye contact. He will push his father away out of room, he will not allow the father to come at home. So once she went to the Himachal for a camp, and at that time she gave so much instruction to mother, and she was daily calling, Papa ne aapko kuch bola to nahi, Papa ne aapko touch to nahi kiya. And there she developed that ulcers, because after that these parents, they made it a point that no, you will sleep in other room, and all the time she's not sleeping, it is always in her mind that my father is hurting my mother, and this, so she's not able to throw that, and it develops the ulcers and this obsessive behavior, and nitric acid helped her. So they are unbending to their opinion and are moved by kind words, apologies, capitulation. They will not compromise their positions, and hateful, resentful, vindictive with those who have offended them. So nitric acid, they will not speak to old partner, family member for years. All these disputes make them anxious, as if they are involved in lawsuit. So that is, they don't compromise. That is what the nitric acid. So this rubric, you can take this screenshot. These are the remedies which can prove to be good compulsive disorder remedies. So now I'm talking about, I know I'm running out of time, but still, okay, let us see where we can reach. So these are some misused rubrics. Why I call this misused rubric? Because whenever you get a person who is washing hand, who is keeping things in order, the first rubric which come to your mind is fastidious. So fastidious is a great tool, but never limit. As I told you that washing hand has only 12 remedies. Same way fastidious has only 25, 26 remedies. So we cannot fit all the OCD patient into 25, 30 remedies. Means this rubric is most of the time misused rubric. Same way average, as I told you, most of the OCD patients are average too. They have fixed ideas, they are procrastinating, they are taking a lot of time, fear contamination, trust desire. These are the misused rubric in the OCD cases. So you should use these rubrics in OCD cases because these are the disease symptoms. So never base your prescription on these rubrics. Rather, as we have seen in Platina case, that if we have prescribed Platina, it covers the washing hand, but never start the case, repertorizing case with the washing hand rubric. Never start the case repertorization with these rubrics because these are the common symptoms of the disease. So what does fastidious means? Means it is difficult to please. Fastidious is not about cleanliness. Fastidious, why fastidious clean? Because you cannot make him satisfied about the cleanliness. So cleanliness is not fastidiousness. It is a person's trait who is hard to please. You cannot satisfy them, delicate to the fault. Everything has to be just so. So they see that this thing has to be done this way only. Only one way to do the thing. Disdainful, squeamish, rejecting what is common or not very nice, suited with difficulty. So if you go to the fastidious, this censorious, critical, conscientious about trifles, these are the rubrics which come very close to fastidious. So you should take. Now, fastidious in OCD. If you see the common fastidious remedies, I'll give you some hints. That arsenic, yes, arsenic is fastidious, but it is for order and cleanliness, which is an OCD trait. Kalikav is about order and obedience. Netramir about punctuality and schedules. Naxwamika about output and production. Carcinosin about personal responsibility and caregiving. So these are some of the traits where you understand these remedies in the right context. I hope you are getting me. Again, I'm asking this question, whether I'm not very fast or I'm not very slow. Dr. Sharma, can you please?
Yeah, we are okay. We are okay. Please go on. It's just 10 minutes more.
Okay. I think I'll not be able to finish up my presentation today. Okay. So
Don't worry.
some clinical tips, all hysterical remedies has OCD. So now another case. So this is of a lady who was suffering from OCD for 10 long years when they approached me. She used to have a dream that she's passing through a street full of mud, blood, and shredded flesh of animals, which awakes her, and then she starts washing her hands, following by bath. She gets this dream by 2 a.m. and then keeps bathing till 11 a.m. for 7 long hours. So they live in a village. So all people around their homes are in trouble due to water lodging around their house. So this is what the husband brought in, that I'm not able to live with this lady. It is hell to live with this lady. Our own of our houses, all our clothes into our wardrobe, and she, even in summers, she washes all our warmers daily, warm clothes, all the warm, even my coats, pants, everything she washes daily basis. So initial prescription on basis of symptom didn't help her for 6 months. Family and relative and we are clueless. So I once again talked the case. I'm cutting short this case. She said that my life is hell. I don't want to live. Thoughts of ending my life are always strong in my mind, but I throw these thoughts away as I have to live for my kids. They are my responsibility. So this was the end information on which I prescribed the remedy Natrum Sulf. Because that mind injure himself must use self-control to prevent shooting himself from sexual life. She said that I don't want to live. Then I said, why you are living? I am living for my kids only. Otherwise, 100 times I get this thought whenever I'm cutting the vegetable. I feel like killing myself, doing suicide by cutting my throat, cutting my arm, cutting my veins or arteries. So, but I always keep on, my whole of the energy goes in controlling myself for not ending my life. So Natrum Self-Tenet helped her a lot. because she was better after this prescription. What I want to tell you is that sometimes your failures got converted when you are getting though. Now this is not an OCD symptom that he wants to, but otherwise will contradiction is a symptom. So natural himself people are very responsible, sacrificing for family, others, like carcinosin, self-control, strong self-control. They have history of head injury, hydrogenide constitution, craves ice and ice cold water. These are the other things which are matching. So my point here again in this case is that you have to consider the person. So some other clinical tips for OCD treatment: coca, washing hand always, and ill at ease in society. They are not comfortable with the society. Lysine, they show strong anger when deceived. They are, because as they are very loyal themselves. So after getting angry, start repenting immediately. Hyacinthus is mistrustful and meticulous in OCD. Medorinum has to keep the secret and keep washing, because these nosodes, they are very good OCD remedies. Washing hand with lot of anticipatory anxiety. Syphilinum, tainted hand by killing. He feels that he has killed something, so no hope, person is doomed. Wash his hand to clean it. You know that syphilinum is also a remedy given in Kent for repeated things and washing hands. Sorinum is mechanical. Must wash often to keep clean. Struggle because they are unwashables. You see this rubric. I'm cutting very short because you all are learned doctors. So I know you have a lot of experience. Maybe you know more than me. So these are just the tips I'm taking. Carcinosin must strive for perfection. Now, another case, or shall I stop? Because I have lots and lots of slides. It's 141 slide and total slides are 252. So Dr. Sharma, what would you like me to take the question answer or continue?
In just 6 minutes more, you can continue. You can take a case if you want.
Major thing is now I'm going on to the next level of my presentation, where I would be talking more about the strategies Dr. Henneman has given. So it is a long talk. So I think that I'm always at the midway of my presentation. I have 252 slides, and right now I'm at slide number 143. So around 100 more slides are there.
Okay, you can just summarize, what we have presented, so that we can listen to another webinar, which will be held separately.
Right.
Okay.
So till now, I would give you some points. That the major point which carry home points is that never this confused this with these three things: obsessive-compulsive disorder and obsessive-compulsive personality disorder. So personality disorder is something different. Other thing which I have summarized is important is differentiating between OCD and autism, and differentiating between ADHD and OCD, and in children, as I have told. And another thing is important is that someone was asking to show me this platina repertorization chart again, because in this case, this disease symptom, as we have two repertorization sheets, one is the leccan and other is the platina. So leccan is representing the disease itself, while platina is representing the person itself. So we in OCD, we have to take the person into consideration rather than the disease into consideration. If you take this trick away, you are solved with many cases. So in the next part, I'm showing you some of the glimpses of my the ready, which is be ready with me. So we'll be solving a case in the second part. So I'm not then review of the case. So how I solved this case again, I have to make the different prescriptions. Then more perspective like OCD and chakras. The these 7 chakras we have into body, how we relate these cases. Then these 5 elements and chakras. Then we have these 5 so different strategies, that whether counseling is important and how to do the counseling part. So whether to do the counseling or not, in what cases it is effective, and in what cases the counseling is not effective. So these are the things which the role of counseling according to Dr. Hahnemann. So effectiveness of counseling. So Dr. Hahnemann in Organon of Medicine and different Materia Medicas and his different write-ups, he has mentioned a lot about mental illnesses. So we'll be talking, so these the strategies, how the patient should be approached and how, what are the different aphorisms where we can talk about this Hahnemann strategy. I have worked about different slides. Then another patient, that how to see the follow-up of the case, because they say that when the mental disease improve, it goes to some other systems. So what are the systems on which it can show? So these are some real cases which I have compiled. So I think because it's I would not be able to conclude it in 5 minutes. So there are a lot more to come. Thank you for giving me this opportunity. These are my contact informations. You can always contact me on WhatsApp. Maybe I won't take call, but thank you for OHMA. You people have really done a great job and bridged, because I can see in the list many people from Malaysia, Singapore, UK, and whole of the world, and a lot of my Indian friends. Thank you, because you have joined to listen me. Thank you all.
Thank you. Thank you very much, Dr. Muktinder ji, for your great presentation. Really excited to see your followers and audience all over the world. And would like to take questions now from our audience. The first question which I can see there is, can a person of fastidious nature can get converted into OCD patient?
Yes, as I have already told that this is being fastidious can be just a part of obsessive compulsive personality disorder. So obsessive compulsive personality disorder people are always prone to get OCD as a disease. When it turns into the OCN, so they will have their basic nature the same. That will never go away. So basic nature will always remain the same. So we cannot rule out that a fastidious person cannot be an OCD patient or an OCD patient having fastidious trait. So they are intermingled. So you cannot separate these two things.
Good. And the second question was, is fear of poverty an OCD?
Yes, as I told you, that avarice, that greediness, and that symptoms where the person is holding on to lot many things is important part of OCD. So yes, fear of poverty can be a great insecurity in OCD patient. Yes.
Thank you. And the other question was, may I know what make the girl feel scared of snakes? In your case.
So as I told you, that brain lies, these delusions, these kind of things, they never has a relevance. You cannot make them relevance, or you cannot connect them to their real life incidences. Might be she has seen a snake or not. So it is a delusion. Delusion is something which has no grounds. So it is always a baseless thing. So you cannot pinpoint that, yes, why, from where she got. Maybe she has an event or not even. That is not important. And we are not considering that symptom for prescription also. It is a common OCD symptom.
Oh, okay. And the other question is from Dr. Neetu. If a person doesn't want to drive out, if fear of hitting somebody while driving, can this be taken as OCD symptom?
Yes, it can be an OCD personality disorder or a symptom, because we have talked about that ICD-10 criteria is if a thought is persisting for more than 2 weeks, person is not able to throw that thought, and third is that the thought must not be enjoyable. These are the 3 prerequisites to form a diagnosis of OCD.
Right.
I think, sir, Dr. Sharma, Dr. Chandok sir, he's my senior. He's like my father to me. He has raised his hand. We should give him some time to speak. Can you unmute?
Sure.
Sir, see, apna camera on kar lo, Dr. Chandok sir.
So our admin is Mr. Javed. Can you do that, please?
Yes, I have asked him to unmute.
Thank you. Thank you.
Hello.
He is unmuted now, and please, if you want to turn on your video.
Okay. Anyway, I had raised my hand long back. If I've been given a chance now, I would just say that Dr. Muktinder Singh has today given such a genuine, professional, scientific, and a very interesting presentation. Each one of the 223 participants I've just seen, I'm sure, must be totally focused. And those who have heard this, listened to this, or seen this webinar today are going to be real beneficiaries of this. And I know Dr. Muktinder Singh since last almost 30 years, and I very strongly say to the entire fraternity of homeopathy in the world that this man has the prowess of homeopathy. The amount of knowledge he comes out with at random, you ask him anytime extempore, the amount of knowledge he comes out with is only possible because of the prowess, which is a God-given gift to him. So
Thank you, sir.
I think,
Thank you.
with homeopathy, no better speaker than him. God bless him. God bless him.
Thank you, sir. Thank you. Your blessings are so important.
Thank you, Dr. Chandok. Thanks again, Dr. Muktinder Singh ji. I think for your great presentation on OCD, and it really was very interactive and educative. I would also like to thank the participants globally from all over the world, including our guests. And I now request OHMA President, Dr. Surojji, to make announcements and to give concluding remarks. Thank you.
Thank you, Dr. Sharma. Before I make the announcements, I agree with everyone that we do need a second part of this webinar. We'll be announcing the date very shortly. Okay. Now I would like to thank Dr. Muktinder Singh ji for your great presentation on OCD, which is one of the very difficult to cure mental illness of today. Your presentation has given us clear and simple approach to deal it from homeopathy perspective. We're looking forward to the second part of this presentation in the very near future. So many thanks to you, Dr. G. OHMA would be sending the certificate of participation by email. Kindly make sure that we have your email address with us. Those attendees who wants to have a group snapshot, please wait. And I thank you everyone for attending this educational webinar conducted regularly by OHMA. Also, I'd like to thank Dr. Bhupinder Sharma for moderating this event, Board of OHMA, and Javed for the success of this event. Now, the announcement for our future webinars. Our next educational webinar is on September 26th from 10 a.m. to 12 p.m. The topic of this webinar will be Understanding of Psychosomatic Diseases and the Homeopathic Perspective of Their Management, Part 2. The speaker, as you all know, is Dr. Lina Bagadia, LCEH, MD, PGD, MLE, CCMP, PhD scholar, homeopathy, psychiatry, and consulting homeopath, a well-known international speaker. So please mark your calendar for September 26th from 10 a.m. to 12 p.m. Now, let's have a snapshot, and then we can enjoy our Sunday.
Thank you very much.
Turn your cameras on. Yes, please. And Javed will.
So we have 8 pages of the galleries. It may take few minutes.
Okay, no problem.
So I am going to take first page first, and then we go from there. Thank you very much.
So need a smile from everybody.
Yes,
Say
first
cheese.
page is done, second page is now, and then now third. Yeah, well, I have captured most. Yes, thank you very much, everyone.
Thanks
Thank
again.
you, Dr. Javed, Dr. Saroj, Dr. Sharma, and whole of the homeopathic fraternity. I can see some beautiful faces. Thank you for patiently listening me. Thank you, OHMA.
Thank you very much,
Dr.
Dr.
G.
Muktinder.
Thank
It
you so
was
much.
excellent and very informative
Very.
and very critical seminar, and looking forward to seeing second one.
Yes. Thanks,
Thank you very
everyone.
much.
Have a great
Bye-bye.
Sunday.
Bye-bye.
Bye.
Bye.